sleeping on the just be thinking. And she keep on nothing about everybody leaving. Can't even sleep at night.
Hello, everyone. I'm back with part two. I am so sorry for this delay from part one to part two. I should have been did this, but here I am. And part two will focus on the surgery part. So just to recap, part one was about the diagnosis, and I told you about how I was diagnosed and how I told my family. One thing that I don't think I emphasized enough on part one, real quick, that I want to say is that the way I found my mass or my lump was by visual. So I don't know if I emphasized enough that I want you guys to, when you're doing your self-examinations, I want you to do them the same way your doctor tells you, in the shower, laying down, things like that. But I also want you to start looking in the mirror. That was the main reason how I saw a little dimple on my breast. So I looked in the mirror as I was doing my self-examination, and that's how I saw that little dimple. I had no other symptoms. I did not feel a lump. It was no redness. Skin didn't really change where I could feel it or anything like that. But all that was there was visually, I could see a little bitty dimple. So again, I just wanted to recap and say to extend part one just a little bit on this one, please look in the mirror while doing self-examinations. Okay, so we'll get into part two, the surgery part. So part one focused on diagnosis from about September 27th up until me telling my family, friends and family pretty much, on October the 9th, I believe it was. So from October the 9th to my surgery date was November the 15th. A lot went on. So I went through a lot of doctor's appointments. I went through a genetics test, and then I was scheduled for surgery. So the genetics test was very important. On that, I went through getting the genetics test and waiting for it to come back. That was going to tell my surgeon what the recommendation would be. So they give you a recommendation on if you should have a lumpectomy versus a mastectomy. The genetic tests help you do that with the BRCA1, BRCA2 mutations. Usually, if you have a BRCA1 or BRCA2 mutation, that will automatically almost make the recommendation a double mastectomy. So depending on size of the tumors and things like that, that also changes the game as far as what they recommend for your surgery. So based off of mine, I was BRCA1, BRCA2 negative. I also had a total of 25 different cancer genes. I was negative for all 25 cancer genes. When that test came back, the surgeon at that point recommended that I have a mastectomy only on the one side where the mass is. Sometimes they recommend a lumpectomy. My recommendation, based off of the doctor looking at the size of my tumor and things like that, and the location of the tumor, she still recommended that I have a mastectomy. For some women, that's very, very hard, very difficult. It can just be like really traumatizing. For me, to be very honest, it didn't really hit me like that. All I wanted to do was get this thing out of me. I wanted it off. My first thought was like, cut them off. I didn't even care. But again, that's me. My breast was not a part of my identity, but some women, their breasts are a part of their identity. So I totally get it, and I totally understand how they can feel as if, hearing the word mastectomy can be so devastating. For me, it was not as devastating. It's scary, period, just to have something cut off on your body, but I'm just not attached to my breast that much where I was willing to not even consider it based off of that. I didn't care, cut the thing off, So I was scheduled for surgery. My surgery date was November the 15th, 2018. Ironically, that's my husband's birthday. I was so distraught. I didn't know about my date until literally almost a week of. So I was going to work and I was waiting and waiting and waiting. And they called me and just told me that my date. And that was pretty much the date I had to go in. They didn't want to wait. After that, and the doctor was not available due to Thanksgiving weekend coming up after that and everything. So I was feeling down. I'm like, man, this is my husband's birthday. I don't want to have to have surgery on his birthday, and it just felt uncomfortable. Why, I don't know, but it felt very uncomfortable. So the day before his birthday, which was November the 14th, I went and tried to do a surprise birthday dinner. He's not a birthday person at all. He can care less about doing things, but I just felt bad that, he'll be sitting in the hospital with me on his birthday all day. So I had a little birthday dinner gathering, and family and friends came out, and that was a way to, they gave me their prayers and everything as well. And we had a good time, celebrated his birthday, came home. I had to be at the hospital at 6 o'clock in the morning on the 15th. I arrived at the hospital, went in, and they came in. The plastic surgeon was there and my surgeon. So I had two different surgeries, pretty much, but at the same time, same day. So the first part of the surgery is to remove the mass, the tumor. That was done from Dr. Miller. Love Dr. Miller, but that was Dr. Miller. And then Dr. Long also was going to do his part after that, which was the breast reconstruction. I did opt for immediate breast reconstruction. So I got there at 6 o'clock in the morning. Dr. Long, the plastic surgeon, came in, marked me all up, and I went in for surgery pretty much after that. I had family and friends in the waiting room waiting for me to come out. And from my understanding, the doctor came out and kind of gave them updates and let them know, if your margins are clear and things like that. So margins are basically when they go in to remove that breast tissue with the mass, they want to make sure that, the cancer has not spread other places. They also have to check my lymph nodes. They did check my sentinel lymph nodes, and they removed 3 lymph nodes from that area. What they want to know is if the cancer has spread to these lymph nodes. And the reason being is that once the cancer spreads to the lymph nodes, that basically can mean that you have cancer somewhere else in your body. So that's, pretty scary to wait for that information as well. They did come out and tell her that tell my mom and family that the sentinel lymph nodes came back fine. No, there was no cancer in those lymph nodes. So that was really good information. Dr. Long, the plastic surgeon, did his reconstruction, and at the time of surgery on that left side, he put in a tissue expander. So when you have a mastectomy, I had a skin sparing mastectomy, which means they kept the skin there, but they did cut off the breast and the nipple, and everything was gone. So what he did is he put a expander inside of the breast, and what that does is once the breast tissue is all gone, in order to do reconstruction, they need to still pretty much make like a pocket to form you a breast later on. So they put a tissue expander in there, and when I woke up, that's what was there. So I was not completely flat. It was still pretty flat. It was not inflated that much, but there was no breasts there. Pretty much all gone when I woke up, and I have two drains in there before I can move forward and have them removed. I had to wait about, I think it was about a week or 2. I can't remember. I think it was about a week. So long story short, I stayed overnight there, and then I was able to come home. I came home, and I have to admit, I thought the surgery was going to be one of the hardest part, and it actually was not. Thank God. I was in hardly any pain at all. Most of the pain came from where they took the lymph nodes at, from up under my arm, but I had that soreness there. But other than that, I did not need to take any of the pain meds. Really, I took the pain meds, I believe, the very first day, just because I was nervous. I didn't want the pain to be real bad. But after that, I strictly went to not taking the heavy medicine like oxycodone and stuff like that. That's what they were giving me, get prescribed for me to take, but I didn't want to take that if not needed. So I did wean myself right on off of that. About 2 days later, I was on antibiotics, and I had to have my little notebook. I had to check, empty my drains and clean it and make sure there was no infection there. That part was kind of hard. I was so ready for those drains to come out. So they are attached inside like on the side of my body, and they're pretty much literally draining like the blood and stuff like that. It's kind of icky, but it is what it is. I should need to do. So I had those 2 drains, and when I went back to my first appointment, they were able to remove those drains. I was so happy to get those off. Once they removed the drains, I was able to even start the exercising of my arm, because what happens is when they take those lymph nodes out your arm, now you're susceptible to have lymphedema, which is the swelling of the arm. You basically, to just think of it, lymph nodes are there to fight off infection and things like that. So once they remove them, you have less lymph nodes there to fight off infection and things like that. So you are at risk for swelling in that arm that you had the lymph nodes removed. So I had to go through physical therapy for that as well. So for this surgery, boy, if you don't get, like I said, I went through all of that. Thank God I haven't had to have any problems with the lymphedema or anything. And as of November the 15th, that day, I was considered cancer-free. That's a wonderful, wonderful, wonderful feeling. I was very, very happy about being cancer-free at that point. After you have surgery, what they also do is take the tissue and they test it, and that's where you have a pathology report. So based off of that pathology report, I go from, like I said, 15th, I'm like, yay, cancer-free, happy, let's celebrate. And then about maybe a week later, I get a pathology report. This pathology report, it all came back pretty good as well. The only problem, though, remember I talked about those lymph nodes. So they tested my sentinel lymph nodes, and they were all clear negative for any cancerous, any cancer in them. The problem, though, is inside of the tissue that they removed from the breast, somehow there was a lymph node mixed in with the tissue there, and that showed cancer was attached to it. Now, it left me in this big gray area, because what they're thinking, they called, because it was inside of the breast and mixed in with that tissue, you kind of think, of course, it was kind of attached to where the cancer was. That's probably why it tested that way. Especially since all the other lymph nodes showed no cancer. So even though they explained it to me that way, hey, this is probably just because it was in a tissue and it was kind of attached there. So we're pretty sure that that's why. Anytime cancer goes to the lymph node, it automatically puts you at a higher risk. Even though it was inside the breast and it wasn't one of my lymph nodes like that was under my armpit or axillary or sentinel. So because of that, although I was considered cancer-free, because of that one little lymph node that was mixed in with the tissue, and because of my age, being young, and being African-American and all of that, at that point, that's when everything went downhill for me, unfortunately. That caused me to have to go through a lot of different other treatments that I was not expecting. So originally, the expectation was I was going to have this surgery. If nothing came back with the lymph nodes, all I have to do is take this pill for the next 5 or 10 years. That was what I thought I was going to have to do. Because of that one lymph node mixed in with the tissue, at that point, they recommended chemotherapy, possibly radiation, and that was devastating. I thought I was cancer-free, I'm done and over with, and then to hear that I still had to do chemo or radiation just killed my soul. I really was not prepared for that, and it was hard. So I went from being happy to back devastated. This whole thing is a emotional roller coaster. I have had so many ups and downs, it just doesn't make any sense. So part 2, this one is kind of scattered. I'm kind of talking all over the place here with this, but that's basically how the surgery part of it went. And I have some pictures and things like that I'll show you about the surgery as well. Part 3, that'll get into going from thinking I was okay to these treatments and all of these crazy side effects, and that's what started all of my hospitalization.
Do you understand the words that are coming out of my mouth?
Sorry. And just being sick. So part 3 will go into that, and that's where it felt like just doomsday for me. So thank you for listening as always, and I'll be back with part 3 very soon. Thank you.
lonely, I keep Benjamins on me. Never search for Benjamin, cause I'ma still with my Brody. And my little shorty got my back, she like Yvette and I'm Jody. I know Jay gon' ride for me, one fuck all, then he gon' fold.